And as we progressed, depending on the absorption of the funds, we've seen that
there is enhancement of the emergency critical and chronic illness fund. There is enhancement of primary health care fund. And this, Honorable Speaker,
is going a long way in improving the services within our health facilities. To me, the only challenge has been support from the county governments, because when you talk of level 2, level 3, level 4 facilities, some of them have been slow in terms of registering and providing services to the wananchi. Some of them have had challenges in terms of, even as counties, in terms of paying KEMSA, and this contributes to availability of resources within those facilities. But if the county governments embrace the primary health care fund, which is available for them through the FIF, they must be able to provide all the necessary services within level 2, that's the dispensary, level 3, the health center, and level 4, the outpatient sub-county hospital. And that means mwananchi will only be able to walk in
and walk out with all those services. Because this House, Honorable Speaker, appropriated around 11 billion in this financial year. And in the last financial year, in the initial, we appropriated 4 billion, and subsequently in supplementary, we also added another 3 billion. That means services at those levels must be able to be provided without any serious challenges. But as put by many of our colleagues, one of the biggest challenges between private facility and government and public facility is the level of cleanliness. And I think that is where we should be able to begin from. For some of us who worked in county hospitals, I worked in Baringo as a medical superintendent and also as a medsup, as an MOH in Elgeyo Marakwet and also Marakwet. Honorable Speaker, some of the services which people can testify is that we made sure the hospitals are clean, and in most cases, people would even prefer to come to government facilities. As we speak even today, for some of us who trained in Kenyatta National Hospital, I think anybody would be comfortable being treated in Kenyatta National Hospital at any time. Same to Moi Teaching, same to Kenyatta University Teaching and Referral Hospital. I think it is just a question of a change of attitude, so that you walk into these facilities and you will be able to get any treatment. At one stage during President Mwai Kibaki,
the Honorable Waluke,
an issue of
order. The Honorable Waluke. The Honorable Waluke, talk to your friend. Tell him do the right thing.
Honorable Speaker.
If that's the Honorable Obiri, or you know what to do. Go ahead.
Honorable Speaker, at one stage, governments introduced what we call amenity within public facilities. Because at that, many Kenyans at that stage, they would prefer a more cleaner environment. They want maybe a private room. And these are available within government institutions. So I think it's a question of your attitude as an individual. Today, as we speak, anybody in Eldoret would be very comfortable being admitted at the Moi Teaching and Referral. It's one, I think it's the best facility, and it's a public facility. So, to me, I think it is just that maybe some bit of prestige where people think maybe if I'm treated. I'll give you an incident, Honorable Speaker, that I went to one of the private hospitals 2 days ago because I was cleaning my ear and the earbud, the cotton wool, entered into my ear canal. And I went to one of the hospitals, which is accredited by Parliament. They were not able to do it. But when I went to a public hospital, that was done. It was done in a few minutes, and I left and came back. Okay? I wouldn't want to mention it for just not to discourage any patient from going there. But it shows you that because when I went to that private hospital that is accredited by Parliament, I was told they had to wait for the consultant ENT will have to come on a Tuesday. And this was a Monday. Yeah. While when I walk into the public hospital, it was done immediately because the doctor were available there. So at times we tend to blame our doctors that doctors in private hospitals are not available. It's maybe on that day where they are booked to work to go and work in the private hospitals. No, in the private. But in public, they are available there. In fact, you have more of them there, even both senior and even those who are registrars or they are in training. So this motion where we are resolving that we make it mandatory for every public servant. I don't think it's in good faith to me, the way it is. It is in good faith that we must create trust within our public institutions, that we can go there, you'll be attended, and you'll be able to get the best services. Just like on Monday when I got a good service in a public facility. So, Honorable Speaker, this is a good motion. I think many Kenyans should look at it from a positive point of view. Occasionally, when I'm at home, I go to Endebess Hospital to do operations there. And pro bono, I don't charge anybody because I'm a member of Parliament and paid. And those services that we provide are quality services. And we mentor the young doctors to make sure that this country attains at least this universal health care. With those few remarks, Honorable Speaker, I want to support.
This chance goes to the member for, before the Martin Owino, Honorable Martin Owino, there's member for Elgeyo Marakwet. Then Honorable Martin Owino.
Thank you so much, Honorable Speaker, for giving me this opportunity. And one, I want to actually appreciate the Honorable MP, Honorable Sapina Chege, for bringing this motion to this House. Mheshimiwa Speaker, I actually am a subscriber of the public utilities, public hospitals, public schools, because that is where every Kenyan can afford. And that is where the regulations and good policies are, unlike private institutions. And at times, Mr. Speaker, you wonder why government institution or public institution use taxpayers' money to pay very expensive and very exorbitant private hospitals after getting the money from the public coffers. And yet the services offered in the public and the private hospitals are the same. The only difference, or what I can say is, what brings the difference at times, is you find that the public hospital, the management of the public hospital, it's not the doctors, it is not the services, not the drugs, it is the management of public hospitals that is wanting. You find a public hospital, the moment you enter into a public hospital, there is a synonymous smell. There is something that actually notifies you that you are now entering a public hospital. It is not maybe it is not something you can associate with drugs or anything clinical, but it's maybe something of dirt and disposed waste or something like that. So, Mr. Speaker, now that the public hospitals are devolved and they actually with the county governments, I want to urge the governors, because if from where I sit or from the response of the people of Elgeyo Marakwet, SHA is working with us. And the chair for health has just said that it doesn't work with him. Maybe it's because the hospitals in his area or the people, there are no facilities in his area that can actually accommodate the people who want to use SHA in the public hospital. Or the criteria, maybe they were not guided well on the parameters of what people should pay. In that when people feel to be enrolled in SHA, they get a very exorbitant amount of money, maybe 1,000 shillings, and you find them giving up. But if they are guided well, the mama mboga in the village and the local farmer should pay not more than 630 shillings. So most of the people are registered with SHA. Unfortunately, when they go to 6 services at the level 2, at the level 3, level 5 hospitals in the county, they don't get sufficient services because you find there are no drugs, there are no doctors. That is not the failure of the health practitioners. It is the failure of the management of those hospitals. So if the county governments can up their management a little bit, they get stationed person there, the superintendents there to ensure that people report on work, there are drugs. Even the public hospital should have more drugs than even private ones, because the private, they buy. Where these ones, they procure from KEMSA, and KEMSA, we know, they have even the drugs in excess. So I support this one, but as much as I support, also somebody must do their job. That is the county government. They ensure that they are thoroughly cleaned, because that is the hygiene actually that is putting people off. Unfortunately, Mr. Speaker, somebody yesterday forwarded me, and I'll say it's Baringo County. Somebody forwarded me a patient in Baringo Hospital who was in hospital bed. Though the context was not to look at the service that the patient is getting, but he was telling me there is a reported unknown disease that has been reported. But that person was feeding on a lid of, and it was all over social media. Bucket, the hospital bucket. You see the bucket that people normally carry to go and wash their clothes, and it's green in color. So that person had utilized the bucket to go and fetch beans and ugali there. And it was a green bucket. So you can imagine somebody who is a public servant, or me as Mheshimiwa, Mr. Speaker, or even a primary school teacher, or even a secondary school teacher, or a doctor, like Honorable Nyigal and Honorable Pukose, being admitted in an hospital, then you find them feeding in a plastic, not plate, lid of a bucket. I mean, buying or acquiring even the very cheap plates, the very cheap necessities, the plate, the bucket, the spoons in an hospital, in a public hospital, should not be a tall order. Some of those patients, when they are coming to hospital, they are not anticipating that they are going to be admitted. Some of them are even collected by well-wishers because of the motorbike accidents, and they are just dumped there. They cannot buy them anything to use it there. So I think the governors should just try to make sure that they make it a little bit decent so that the public people can use it. Otherwise, I am an advocate that the public institution should pay money to public institutions to ensure that we are improving the public institutions. That is where we ended up with education in Kenya. It almost got privatized, everything, because people started pouring money into private institutions, and then the private institutions gave extra time to teach. And even the teachers who used to teach in public institutions started paying more money for private teachers who are not even at times trained. They just get somebody who qualified in Form 4, got an A, they go and teach your children, and you pay them a lot of money to teach your children. Here you are a professional teacher, maybe 20 years, 30 years in the service, but you don't even believe yourself that you can teach your child, not even in school, even at home, and pass exams. And we ended up wasting a lot of money, and people ended up becoming very poor because now public institutions were dying. So, Mr. Speaker, I want to support the motion by Honorable Madam Sabina Chege by saying we should actually ensure that the public public institutions make it a priority, public servants make it a priority to go to public institution. But the disclaimer that I still give is that the public hospital should also try. And most of those teachers, all the doctors actually in private institutions still practice in public. And at times I wonder, why can they go and call the management of public hospital and even show them how a private hospital looks like and how a public hospital looks like, because they are actually two worlds apart. Thank you, Mr. Speaker.
Thank you. All members, in the public gallery, students from Karirikania Comprehensive School, Kuresoi North, Nakuru County, and students from Digital Junior Educational Center, Embakasi West, Nairobi County. They are welcome to follow our proceedings this morning and to the Houses of Parliament. Next, I think is Honorable Member for Ndiwa.
Thank you, Mr. Speaker. I really appreciate this time to contribute to this. And Mr. Speaker, from the onset, I want to thank my former chair, Sabina Chege. We used to call her Maito. I'm happy that you are still on top of these issues of health. Mr. Speaker, the most important facility, health facility, for all of us members of parliament is the facility next to your home, whether it's a health center or a dispensary. That is a public health facility. Whether you are bitten by a snake, or you have diabetes, shock, or you have heart attack, or anything, that is the facility that you will stabilize your health. Many times we are saying, which is true, that health is devolved, and we leave it to the county government. But I want to challenge ourselves, because with the arrangement we have now, where health is starting from level 1, where community health promoters are, to level 2, level 3, 4, and 5, we have to get involved, because that management we are talking about, which is okay. In health, in a dispensary, there is what we call dispensary management team that oversees the FIF, which we have already put in place. These are the people selected within our surrounding, and others are expert with them. I think we should also be concerned how they are working and what is their concern, so that they can manage the funds that we are giving now, which is, to me, which is more adequate than we had before. And that is the PHC, and the chronic, and the KEMS arrangement with them to have drugs. All these are managed in those facilities. And the people who are important are those committee members, because they budget and they push for execution to the counties. Just like the schools are run, the BOM and also the teachers by the TSC. We have to be involved. If we could get involved as 349 members of this House, we can get it better. Mr. Speaker, access, quality, and affordability of health is very important, because they all address preventive and promotive health. In fact, if we are talking of funding, we should talk more of funding this preventive and promotive health. Right now, people are showing up in higher facilities with complicated cases. Let's say cancer, level 3, level 4. Diabetes, people walk, they don't know, people walk sick, but they don't know that diabetes is really ravaging the organs. When they show up, they are done. Pressure, same thing. So the funds which we have allocated as the committee are addressing also preventive and promotive health. What is lacking, which we want to see happening, is equipping those lower facilities with the equipment that are relevant to what we are saying. So when you get there, you can get the treatment and the services that we deserve. To me, in a way, that will mandate people to go there. You know, you have to promote, you have to market for things for people to buy. Once we do all those things and people can walk in and get the services, they will not go to these private facilities. The other thing which is very critical is the issue of human resource for health. You remember the US government withdrew so much money which were employing our staff in these facilities. To an extent that you can find a health center with 2 nurses. When one goes on vacation, when one goes on training, the facility is almost closed. More so, the time for our services. Healthcare is not 8 to 4 issue. Healthcare is 24/7. Because I don't know, somehow, this critical illness comes at night. And we talk of level 2, level 3, they are not functioning because there is no personnel. So at least when we talk of funding from the health committee, please agree with us even to increase it to the Abuja declaration of 15%. We are still now at 6-7%. And now that was running because there was another help from the US government. Right now, we are almost on our own. As I said, if we increase the preventive and promotive services, we will have quality of care, and quality of care will reduce disease progression. What kills Kenyans now is lack of quick attention and referral to services so that the diseases progress. Honorable member, you will agree with me, it's not only in Dewa, but crude death rate is now the highest. You attend funerals every week in 10s, 20s. Why? And it's not age specific nowadays. Even young people, when all the times when you hear evolution of cry, you will think it's an old man. Nowadays, it's across the board. And mental issues have even complicated it. So what we are saying is that if we can deal with disease burden at the primary levels, at rural settings and slums, we can prevent many diseases from progressing, and also we can prevent mortalities as we watch it now. The issue of SHA, we are dealing with it now, and SHA must work. And SHA is working in many areas. In my constituency, I've just found out that the impedance right now is the demand to pay for the full year. That money people do not have. And I think we have talked with the CS to look into it. And by the way, a member of parliament, we have a very energetic, one of us who was here, who is now the CS. We're working with the committee very well. They have to reduce that payment to either monthly or bi-monthly or 4 months. Because if I'm a member of parliament, I'm paid, and my contribution is monthly. How dare we say somebody who has no continuous income to pay per year? So that one is being sorted out. The other issue which I found in SHA is that people are still being told to pay some fee for books, for data. Why do we have to go writing people on paper? And we have gone paperless. In fact, we appropriated money here for digital superhighway, which should now be cascaded, and those facilities should be empowered to have computers and go digital for people to appreciate why we have put that money. The issue, the time of paperwork and all this is gone. Let's go digital. Mr. Speaker, the other issue which I would need your help as Speaker of this Assembly, community health workers. I think Dr. Pukoz is the one who said that we need to have change of mind. Health-seeking behavior is not automatic. It will not come automatically. People have to be motivated to go to the facilities, even if they are not sick. Because there are so many walking sick. There are some symptomless diseases that you can only find when you go for a checkup. Community health workers is the key driver of UHC. Madam Sabina, you know that very well. We had this bill here and passed it last term and sent it to Senate, Mr. Speaker. That bill died in Senate. through the wisdom of our substantial speaker, we resurrected that bill, and it was passed here. And I want to appeal to this House. It is now 7 months in the Senate, and it's likely to die. But that bill will streamline all the operations of the community health promoters and how they should be compensated and equipped, and we will prevent so many diseases if we find them on time using these wonderful people. So I have asked my chair, and I'm asking the leadership of this House that we always pass many things for Senate. They should look into this bill and pass it immediately. Mr. Speaker, with those few remarks, I want to support this bill and encourage this motion and encourage all of us to support it too. Thank you.
Thank you. Member for Kitui South.
Thank you very much, Honorable Speaker. You know, my friend seated next to me came in when you were about to give me a chance to speak. And he told me, tell me, in quotes, dunia iko namna gani? So before you called me, he had just started engaging me. So, Honorable Speaker, let me address this important subject before now I settle down to tell him, dunia iko namna gani? Honorable Speaker, first of all, I would like to congratulate the Honorable Sabina Chege, who has decided to come up with this very important motion. And Honorable Speaker, this is a very interesting house and a beautiful house to be. Because today, as we sit, Honorable Speaker, we have the Honorable Fatuma Chege. He was a chair health, and he did a lot of work. Honorable Sabina Chege. Honorable Speaker, I also sat on that seat as a chair health, and we did very good work, and we laid a lot of ground for what is happening today. And Honorable Speaker, in that committee, we had the Honorable Dr. Nyikal, the current chair health. And he was an extremely important member, and he was also useful in laying ground to what is going on.